The Filipinos have learned to live with the virus. COVID-19 cases no longer spike despite the previous political rallies and campaign held in the Philippines. These are emphasized by Presidential Advisor for Entrepreneurship Joey Concepcion, proposing to already lift the public health emergency.
We have to really move on and change our mindset. And even if the infection level goes up, remember, this is Omicron. Even the new variants are all Omicron, so it's more transmissible. But so what? It's still mild. It's like calling, we have a typhoon, a super typhoon, pero wala naman typhoon. So why are we calling it and keeping the state of health emergency when there is no emergency? So we are not using the term properly. We're using it even if there is no threat. So it does not make sense, no?
Concepcion also said most areas in the country are already in alert level 1, which proves the Philippines is no longer in an emergency state.
So alert level 1 is basically almost normal, no? So my point is that why are we calling this a state of health emergency when I feel that there is really no need, because countries that are even at level 3, as pointed out by CDC, are not in a state of health emergency, no?
However, the Department of Health said there are several factors to consider before lifting the country's public health emergency state. Health spokesperson Undersecretary Maria Rosario Vergeres said the number of COVID-19 cases is just one factor, as they also have to consider emerging COVID-19 variants and subvariants that might affect the healthcare system in the country.
For now, dito sa alert level natin, our areas are mostly in alert levels 1 and alert level 2. As long as there is this alert level, we still think that the emergency requirements or actions are still needed. Because in these alert levels, we can still see that the cases are still there, and also our hospitals have to be guarded.
Undersecretary Vergeres also emphasized that there's an operational implication in lifting the country's public health emergency. One example of this is the country's emergency use authorization of COVID-19 vaccines.
Pag nag-lift tayo ng public health emergency or the state of calamity, yun pong EUA ng ating mga bakuna ay hindi na po magiging valid. So kailangan, para tayo makapag-transition into that stage, no, kung saan non-emergency na ang turing sa COVID, kailangan magkaroon na po ng Certificate of Product Registration ng ating mga bakuna. Gayon din yung mga gamot na ginagamit natin ngayon that we are using as special compassionate permit.
The DOH also said they are taking baby steps, and lifting the country's COVID-19 state calamity is still being discussed by authorities. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.